Welcome back. I'm Dr. Ankur Khandelwal. Today I'll be showing you one classical case of sacroiliitis, how to clinically diagnose sacroiliitis, and how to perform sacroiliac joint injection guided by ultrasound. So this is a gentleman, 62 years male, who has come to us with severe pain in the left lower back and the buttock region. When he had come, hardly he could walk properly, and he was escorted by his son. So clinically, I am suspecting him to be a case of sacroiliitis, and I will show you the tests that needs to be done for diagnosing sacroiliitis. So number one is compression test. So how do we do compression test? See his expression. कौन सा साइड में पेन हो रहा है? कौन सा साइड में? लेफ्ट साइड में जो ज़्यादा पेन हो रहा है. So what we have done, we have compressed the pelvis, and he is complaining of severe pain in the left side. See his expression. He is complaining of severe pain. This is compression test positive. Next, we move on to the Faber's test. So how do we do the Faber's test? Faber means flexion, abduction and external rotation. This test is very good for diagnosing sacroiliitis. So how do we do it? आराम से करो. At the hip joint, externally rotate it and do it like this, okay, on top of the other lower limb, okay, and try to press it down. Big one है ना? So this I am doing on the right side. He had come with the pain on the left side. So when I am pressing it down, if it is a case of sacroiliitis, I will not be able to move it down because he will complain of pain. Now see, it is comfortable. There is no pain on the right side. I will do it on the left side. This is flexion at the hip joint, abduction and external rotation. Now see, he is big वैसे दर्द हो रहा है. See his expression. Show his expression. He is complaining of severe pain now. दर्द हो रहा है. So this is Faber test positive. Hardly I am able to move it down. And see his hands. His hands are holding his pelvis. So this is flexion, Faber test positive. Severe pain. This is second test. Move on to the Gensler's test. How do we do the Gensler's test? Hang the affected limb by the side of the bed, okay, and flex the other limb at the hip joint. So how do I do it? This is the affected side. So I will try to hang it down by the side of the bed and flex at the other joint and put a pressure and a counter pressure. See his expression. He is complaining of severe pain. इनका दिखाओ. He is complaining of big हुई से दर्द हो रहा है. So this is Gensler's test positive. We ask the patient to prone. So we have seen the three tests in the supine position. I will show you one test in the prone position. This is the finger pointing test. These are the two dimples which corresponds to the posterior superior iliac spine. So if I press on each side one by one, so I am first pressing on the right side, on which there was no complaint by the patient. Big हुई से? অলপ হয়েছে?
অলপ এখানকার হচ্ছে কিন্তু এরপর একটু
ঠিক আছে. So now see, when I am pressing on the left side, he is complaining of severe pain and shouting in pain. This is the finger point test positive, and the finger needs to be pressed on the sacroiliac joint. So these are the 4 tests for diagnosing sacroiliitis. First, pelvic compression test. Second, Faber test. Then Gensler's test. These 3 tests were done in the supine position. In the prone position, I did the finger pointing test, which is the 4th test. So these are the tests for diagnosing sacroiliac. Now what we do is that we will do a sacroiliac joint injection by ultrasound by putting 40 milligram triamcinolone with local anesthetic and ozone 40 to 50 microgram in the sacroiliac joint. Stated all the clinical test of sacroiliitis, and which came out to be positive. So now we are proceeding for the ultrasound guided injection of the sacroiliac joint. So I painted and draped the patient, gave a local anesthetic injection, and see the probe orientation. I have taken a linear probe in and around the region of the posterior dimple, that is the posterior superior iliac spine, and I am trying to focus the sacroiliac joint. Now see on the screen, if you can see the 2 bright hyperechoic structures. Can you show by finger? One is this one. Yes, this is the medial end of the sacrum, and the on just uske baad, yes, and this is the lateral end of the ilium. So we'll try to attempt an injection. The beji diya so ha beat no ho sinta kore bana lage. So I am going through this point. Wait. एक सेकेंड प्लीज नो लोरी see the injection. Now it is straight away. See in the needle, this is in the sacroiliac joint. You see a give way. See when you put it inside. Pause kar do. So as I had shown you 2 hyperechoic structures. On the right side of the screen is the medial end of the sacrum, and on the left side is the lateral end of the ilium. So I had injected into I have taken a spinal 25 gauge pinky needle, and I have directed the needle into the sacroiliac joint, right? And then see the needle is going so freely. Even if you can see now, the needle is going. But beyond this point I will not insert the needle because I have the chances of perforating the rectum behind. So I will keep the needle here, and the needle is freely moving into the sacroiliac joint. Clear? Now I will inject 40 milligram of triamcinolone injection into the joint, which is going very comfortably. So I am injecting this injection triamcinolone into the sacroiliac joint, 40 milligram, right? And I will supplement this with 50 microgram of ozone. This is the ozone gas, and I will supplement this with 50 microgram of ozone, right? And that is how the procedure is completed. And after the procedure, we will do a re-examination of the Faber test to see that if the patient is relieved of the pain or not. Post injection, let us see how the patient responds to Faber test. Okay, so initially, if you remember, the Faber test was positive. Now see, it will still be positive, but he will definitely have less pain. So if you remember, during the initial examination, when I had made this position and tried to move it down, he complained of severe pain. Now see, flexion, abduction and external rotation, I am trying to move it down slowly, and he is still comfortable. The patient is absolutely comfortable, and this movement has totally come down, and he is not complaining of any pain. See, this limb has come below this limb and there is no pain. So this means that the injection was well placed into the sacroiliac joint. Thank you for watching the video.